as you know, launched this and now more practices are using it, as far as like the training goes, how's that when it comes to that? Was there a lot of issues there with the practices that you worked with as far as getting into their workflow?
So the thing is that when you're talking about training, good thing about this thing is that your employees are going to deal less with it.
Yeah.
Because the thing is that mostly the patients are using it and it's self-checking, right? I want you to think about this one example. And when you told me about standing in the line, you go to McDonald's these days, they have a kiosk, a huge kiosk sitting right there. You can go you can give an order to the cashier, or you can just do it right there and it will print out as
and just wait.
Just wait. So how much technology does that cashier have to deal with that kiosk? Almost zero.
No, nothing.
Right. So in the back end,
they just point to it.
Right. In the back end, our tech team actually takes care of
that.
And I feel very proud of that, just because that's the one technology where your staff have to deal really, really low from the time perspective.
You just have to plug it in.
Plug it in, yeah.
That's it. That's all you got to do.
Yeah, plug it in, maybe 10 minutes of training.
I love that. Now, as far as the whole platform goes, again, you've been on before. We talked about the forums. Again, I want to lead with the fact there's so many different platforms out there. But what you have to ask yourself is, does it do the core job correctly and efficiently? You can have all the bells and whistles. You can have all these things. You can have more and more different features. But if it can't get the data that we need, what good is it, right? It doesn't do anything. But as far as having this kiosk function, how does that work for those who are, they've been on the fence and they're thinking about income consent? Is that like an additional thing? Are you putting that as part of the whole package? How's that all set up?
I'll tell you this. This will not work for everybody. And I'm going to be very honest with you.
Okay.
It's not for everybody.
So I want to point out you saying that, because again, if he was just selling something, he would just say, "Oh, this is the greatest thing ever." So you're admitting, like, some offices are not.
No, you just have to know if this something, because not everything is built for everybody.
Yes.
If you're not a busy office and you're just going to see 5 patients, you know who they're, and you're just fine with that, and I don't think it's going to work for you.
Yeah, and if you're still doing paper charts, this is not going to work.
Yeah. So if you're doing paper charts and you're comfortable with that, I'm not going to sell you that.
Yeah.
I'm going to tell you that it's only for people who are struggling with patients waiting for them to talk. Okay, it's for people who are struggling to hire enough staff members and they don't have enough help in the front office, right? So that's when I would come and say that, hey, we can help you. Yeah. No, you're good with what you have right now.
Yeah. I love that. And so for those who they want to take advantage of this, right? Again, not too many. There's other platforms that say they do a kiosk function. Just to let you know, I'm one of the beta testers as well. It is a true kiosk, and I love it. Again, some people may not like going to kiosks when they go to the stores. I'm that guy, actually, that goes to the self-checkout all the time, because, at the end of the day, look, if I want to talk to someone, I could just yell across and say, hey, how you doing? But a lot of times I just want to get my groceries and leave. Same thing at McDonald's. I want to get whatever my kid wants and just leave. So I love that.